When he said you have diabetes, I didn't get terribly upset because I didn't feel any different.
I'm trying to manage the diabetes, not the diabetes manage me.
This is a disease. It's not going to go away. But with good management, good physicians, you can have a healthy life.
I'm Susan Hunt, and today we're going to talk about diabetes. It's estimated that 80 million people in the United States have diabetes or are on the verge of developing it. About 6 million people with type 2 diabetes don't even know they have it yet. It's a serious, lifelong condition, but there's a lot you can do to protect your health. You can live well with diabetes.
We're all at risk. It's the epidemic of modern age.
Okay, 1, 2, 3.
There are certain days that I wonder if I did a family medicine residency only to become an endocrinologist. People are sometimes shocked and surprised when you tell them that their sugars are elevated and that they have diabetes. They won't sometimes believe you. There's a multitude of organ disease that goes on with diabetes, and it's not as simple as treating the sugar. We have to be very aggressive with treating pretty much the entire body, focusing on the eyes, the kidneys, the heart. I think it's important to educate folks, and that can be partially through their healthcare provider. It can also be through a nurse, such as a clinical care coordinator that we have in our office.
The thing that affects your blood sugars the most are sugars itself or the carbohydrates. That's what makes your blood sugars high.
And also through diabetic education, where you see a certified diabetic educator, nutritionist. We encourage our folks to go to the classes, learn as much as they can.
The best time to exercise when you have diabetes is an hour to an hour and a half after a meal.
The patients that always do the best, the patients that have the least complications, the least visits to the hospital, the least visits to the ER, are the people that buy into the idea that I'm only part of this process. I mean, I'm sort of the quarterback, I guess. I call the plays, but I'm going to give you the ball and see where you're going to run with it.
I'm type 1 diabetic. It just happened out of nowhere. Well, it started with blurred vision. I also had, at the time, the classic diabetes symptoms of increased urination and thirst.
He always has watched his diet. He always has remained physically active and in great shape. And Kevin, unfortunately, developed diabetes just because of rotten luck.
All of a sudden, my pancreas abruptly stopped, and I was overwhelmed for the first 48 hours, totally overwhelmed with everything I had to do. It was kind of like a crash course all at once. I didn't even know what insulin was. I had no conception of sugar levels. I had some past experience with friends, one of whom passed away that had diabetes, and I immediately recognized the fact that I had to get control of this disease, that I could not let this disease control me. I'm checking myself 4 times a day. And I'm sitting on every piece of food that I digest. I know exactly what that's doing to my sugar level. So I had changed my diet around from being carbohydrate-based to protein-based, and with a lot of complex carbohydrates with fruits and vegetables. I found that physical activity would drive my sugar levels down. It is so routine for me at this point, I don't even think about it anymore. My wife, Joanne, she's been right there for me, my mainstay on the home front.
Now look at your number. It's outstanding. That's impressive.
I know that Dr. Dillamarter and Ann are just a phone call away. They've always been there for me.
I really need you to see the eye doc, and they give you the drops, and they open your eye up, and they've got their machines to be able to look in the back of the eye to tell if there's any damage at all from the diabetes. And typically we have you do that at least once a year.
Don't pretend like it's something that the doctor is going to fix for you. It's a very controllable disease. It should have minimal impact on your lifestyle if you just pay attention.